Dr. Davidhizar, let's talk about acid reflux. Lots of information out there, lots of contradictory information, in my humble opinion, or at least confusing information, maybe not contradictory. Can you tell us a little bit about what this is all about and how we should treat it?
Well, acid reflux is, of course, caused by too much acid in your stomach. And it can also be caused by having a poor sphincter. That's the muscle that keeps your lower esophagus closed so that the acid from your stomach can't come up into your esophagus. So there can be several different reasons for it. There's a bacteria also called H. pylori that causes a lot of problems with reflux. And that's, usually we can cure that pretty well by just taking some antibiotics and some proton pump inhibitor, which is like Nexium and the purple pill, see advertised on TV all the time, and some of these other medications. But a lot of people have too much acid in their stomach because they're stressed, anxiety, those sort of things. And when you have too much acid in your stomach, somewhat's bound to get up into your esophagus, and that's what causes the heartburn and the irritation in your esophagus. Your esophagus isn't designed to handle acid like your stomach is. So if it gets in your esophagus, you have a lot of problems. And actually, if it gets bad enough, you can actually develop cancer of your esophagus from the constant irritation. So we frequently do endoscopic exams of your esophagus to make sure that that's not a problem, especially if you have a chronic condition where you're having a lot of trouble. Most patients really respond well to the treatment, so we don't have to really check them out. But if their symptoms persist, then we look in there and see what's going on. But so there's lots of different reasons for having reflux. But most of them can be treated fairly easily if we know what's going on. If the sphincter is not strong enough to close, there's some medicine that will help that get stronger to close that off. Some simple tricks you can do too. A lot of people have more of their trouble at night when they lay down in bed because now you don't have gravity holding the acid in your stomach. You can just sort of raise the head of your bed up 4 or 5 inches, and sometimes that's enough to keep the acid from coming up in your stomach and getting rid of your symptoms. So and of course, the other problem is some people confuse a heart attack for just being heartburn, and so you have to be aware of that and not make that mistake because that's a big mistake. But by understanding, what's a little different, usually you can differentiate between those two.
And how can you give us some hints on how can you differentiate those two in terms of feeling?
Okay, well, frequently, of course, with a heart attack, you're going to have pain in your left arm and numbness and tingling. It can go up in your jaw as well. You frequently have, you sweat, you're diaphoretic. You can have some nausea with it too. That's why a lot of people think this is just heartburn. But usually it's much more severe than your typical case of indigestion or heartburn or reflux. But if you're just aware of those signs, and if it's anything that's a little unusual, it doesn't seem to want to go away, you should see your doctor right away, and they can determine that fairly easily with some tests.
Not go away for what? For weeks, months, days?
Hours? Oh no, an hour or so. If you're still having a lot of trouble in an hour, after taking, if you're having a lot of trouble, you should take proton pump inhibitor, those sort of things, like your Nexium. And if after a while that's still not working, you should be seen right away.
I see.
So I wouldn't give it very long.
I see. Okay, so we're talking rather short time. So
right.
Anything people, can do to prevent acid reflux, eat different, or does it, if they're, let's say, more prone to it, to do this, valves not working or whatever, but is there something they can change in diet or in other habits that it doesn't come so heavy or severe or never, maybe?
Well, real spicy foods, alcohol, those type of foods that they're going to irritate your stomach, those are things you need to avoid. If you have trouble with a weak sphincter, there's probably not a lot you can do to make that go away without taking some medicine. But as far as foods go, those are the main things to avoid is spicy foods and alcohol.
Okay. Now, there are obviously, or there are operations out there. In fact, they call it currently like a minimum invasive surgery for it and stuff. Is that the last resort, or is that a pretty good resort in order to not to have those problems anymore, or what do you think about those surgeries?
Well, those surgeries only work for certain conditions, and one of them is hiatal hernia. If you have a hiatal hernia, well, that's where the part of your stomach goes up above your diaphragm, up into your chest, and those people all have trouble with reflux because the sphincter doesn't really keep the acid in their stomach, and so frequently those people have to have surgery. But for the rest of the conditions, most of the time we treat them with medications, with diet, and sometimes blocking up the headboard of their bed. Those sorts of things usually solve that problem for them.
Okay. What about the over-the-counter stuff you buy and see advertised on television and stuff? Good, not good, doing the job?
Well, that'll help. Yeah, that can help some. If you don't have too severe case and that works, then that's fine. I would use that. But most people eventually have enough trouble that those medications or those over-the-counter medications don't do much for them. So they have to resort to more prescription medications, which, of course, are much stronger but have much better results. Okay.
Well, again, very informative. You're definitely shedding light on stuff which many of us simply want to know and are confused about. Thank you very much, Dr. Davidhizar.
You're welcome.